Hi, my name is Chris Lathan, and I'm a medical oncologist at the Dana-Farber Cancer Institute. I really wanted to talk a little bit about why I became interested in lung cancer, which is where I've spent the last 18 years focused on lung cancer. And the main reason I picked lung cancer as an area of focus was because I was drawn to the patient population. And there is just such a great need for clinicians and researchers. I really felt that that was a place I had to be. Maybe it's because the patients reminded me of, folks in my own family, aunts, uncles, brothers, and sisters. I don't know, but I know that I needed to be there. And I know that I wanted to focus on taking care of this patient population, which is where I spent my whole clinical career. In addition to that, I've been also interested in making sure that everybody has the same access to therapy. So when you hear these words about racial inequities, class inequities, or, I'm really it boils down to making sure that no matter what your insurance is, what kind of work you did, what your language is or your skin color, you should really be able to get the same access to therapy as everybody else. And that's something that's really, really important to me. And I've spent a lot of my career focusing on how we can make it better because we have such great therapies. It's really important that people have access to them. And I think a corollary to that is to address a myth. One of the major myths about lung cancer is that if you don't have an early stage lung cancer that can be addressed with either surgery or focused radiation, then there's no treatments for you. That is categorically untrue. I just wanted to say, while it's important to try to be involved with screening, if you qualify for screening and find the cancer early, absolutely, it's easier to cure that way. But don't be convinced that there are no therapies, even if you have an advanced or late stage disease. There are great therapies out there, and their therapies have really changed the way that we think about lung cancer, even in the advanced stage setting. So I recommend people, if you do get diagnosed or people have family members who are diagnosed with lung cancer, make sure they talk to somebody who's specialized with lung cancer, at least for a second opinion, to make sure that they are getting the most up-to-date opportunities for therapies and clinical trials. And I want to close with kind of a call to arms and say, thank you very much for anybody who's really focused on lung cancer research or donated their time, effort, or money to lung cancer research, and certainly also to advocacy groups like LungStrong, because the truth is, without support for research, without support from the advocacy groups and folks like yourselves, folks like me, and folks like my colleagues who are in the lab, it's really like working one hand tied behind our back. We really need to hear from people in the community, and we need their interests, their efforts, their talents to work on the areas, outside, whether that's policy, whether that's research, whether it's just focusing people on the need of many lung cancer patients, because this disease affects our family members all the way through. It's not something that is just for folks who are exposed to tobacco. And so I think it's really, really important to continue to support groups like LungStrong. And we really say thank you for your efforts and interest, and we look forward to all the changes that we're going to have in the future.